Imagine a sudden traffic jam on your brain's highway, abruptly stopping the flow of vital resources. When this happens in your body, it can lead to a serious medical event. So, is an ischemic stroke always caused by a blood clot? While blood clots are indeed the most common cause, an ischemic stroke is not always exclusively due to a blood clot. The core characteristic of an ischemic stroke is a blockage in a blood vessel that prevents adequate blood flow to a part of the brain, leading to brain cell damage. The primary reason blood clots, also known as thrombi or emboli, are so frequently involved is due to conditions like atherosclerosis. This is when fatty deposits, or plaque, build up in your arteries, narrowing them and making them prone to clot formation. When a piece of this plaque breaks off, or a clot forms directly on the narrowed vessel, it can travel to the brain and get lodged in a smaller artery, cutting off blood supply. However, other less common mechanisms can also lead to an ischemic stroke. These include severe narrowing of brain arteries without complete occlusion, called stenosis, or a condition where the artery wall tears, known as arterial dissection. Very rarely, an ischemic stroke can be caused by conditions like vasculitis, which is inflammation of blood vessels, or even certain genetic blood disorders that make the blood too thick or prone to clotting without typical plaque formation. Understanding these different causes is crucial for proper diagnosis and treatment. For example, a doctor might use imaging techniques like a computed tomography angiography, often called a CTA scan, or a magnetic resonance angiography, an MRA scan, to visualize the blood vessels and identify the exact nature of the blockage. This helps them determine the best course of action, which could range from clot-busting medications to surgical interventions. Recognizing that while blood clots are the leading culprit, other factors can also lead to an ischemic stroke empowers you with valuable knowledge. It highlights the importance of addressing underlying health conditions that affect your blood vessels and underscores why a thorough medical evaluation is essential to pinpoint the specific cause and receive the most effective care for optimal brain health.